My goal with this presentation today is to take some of the mystery out of veterinary medicine and turn you all into well-informed owners so that you can ask your veterinarian intelligent questions about your performance horse and take responsibility for their care. We have a lot to offer the athletic equine these days with all of the advances in therapy and medications that have come about. So the more aware you are of what can affect their performance, the more equipped you'll be to advocate for your horse and keep them performing at their very best. So for those of you who don't know, and that weren't listening to Crystal a minute ago, I'll let you know that one of my favorite activities outside of veterinary medicine is bow racing. And for the last several years, I've been competing in the CPRA trying to fill my pro permit card. So this picture is a special one to me because it's the first pro rodeo that I actually made a check at. It wasn't a huge check by any means, but it meant a lot because of all the blood, sweat, and tears that had taken to get to that point. For a lot of competitors, one of the biggest factors in succeeding is the mental part of the game. And for me, part of conquering that mental part of the game is knowing that my horses are feeling 100% before a competition, so that that's not, I don't have any doubts about their abilities. I can send them in there knowing that they're gonna perform the very, very best if I can just do my job. So this talk's an overview of everything that I think about my performance horses and things that I recommend to my performance horse clients. Having said that, 45 minutes to an hour is a very short amount of time to try and talk about everything that's involved in maintaining the performance horse. So I packed a lot into this presentation, and I hope that even though I can't go into everything in immense detail, I hope it gives you a chance to think about some things and areas you might want to learn a little bit more about. So if there's a problem in any of these areas on the slide here, there's a good chance that it's going to impact your horse's performance. So the first thing, and probably one of the most important things, and in some cases one of the most overlooked things in terms of maintaining the performance horse, is the actual conditioning. And there is a difference between training and conditioning. Training is changes in their behavior that are induced by certain practices, so repetitive maneuvers, teaching them different things, whereas conditioning is the actual physical adaptations of their body that occur in response to repetitive exercise. So the goal is to stimulate those adaptations that maximize their performance and minimize the risk of injury. So to reach this goal, exercise sessions and rest periods need to be well designed and balanced. When training is too vigorous or rest periods are too short or there aren't enough rest periods, performance can be reduced simply because they don't have enough time between that stress and recovery from that. And the interval between those training sessions needs to be sufficient to allow that adaptation to occur. Otherwise, we can get fatigue, and fatigue is one of the things that leads to the most injuries. It's also good to know that horses need to regularly perform the type of activity that they're going to be expected to do in competition at the same intensity that they're going to be doing in competition. That's going to induce those physiological changes that will permit their optimal performance. So as an example of that, a horse that's trained for endurance is going to be very poorly trained for sprint racing. They're not, they need different types of conditioning for those different activities. So this slide outlines a list of factors that should be considered when designing a conditioning program. I don't know if any of the rest of you are as obsessed with the Olympics when they come on as I am, but they always get me thinking about how much more in tune human athletes are with discipline-specific conditioning. They do a lot more really specific activities depending on what thing they're competing in. And unfortunately in horses, there's not nearly the same amount of science for discipline-specific activities. But there has been a reasonable amount of work done in race horses, and I think because race horses are expected to perform at a very elite level, those are studies that we can use to adapt to other disciplines as well. So some of the things that they talk about factoring into conditioning of race horses, and by deduction I think all other athletic horses would do well with it as well, are different types of exercises and integrating those into the training program. So one of those is interval training. Interval training is where you do short bursts at high speed and then take it back down to a lower level. We'll talk about that a bit more later. Hills and inclines is another type of activity that just changes the demands on the horse. And then there's resistance training, whether that be with a treadmill, going through water, deep snow, using TheraBands, which are designed to increase resistance. All of those things can really round out the conditioning program. The other thing to factor in is the length of the training program that's required, the conditioning program. So that can range anywhere from 6 to 15 weeks of time that's required before a horse is ready for competition. The lower end of that is for horses that were previously fit and just need to be brought back into work. The higher end of that is for the young horses that haven't been started yet, or for older horses that have sat around for a little while that need a lot more time to get back into shape. As an average general rule of thumb, I think 90 days is a pretty good time to give yourself to actually get a horse back into competition shape. The intensity is something that needs to be monitored pretty closely to avoid injuries. If we jump into something with really high exercise intensity, the recovery period needs to be that much longer to allow the muscle damage that they sustain to recover and rebuild itself. And it's interesting that exercises of long duration at really low intensities are actually a lot more effective at improving aerobic capacity, so their ability to work, than short exercises of high intensity. And then the other thing to factor in is sort of the total working time during a training session. I think it's really easy sometimes to skip that warm-up period, which is, a solid 10 minutes just at the walk. I know I get antsy sometimes and I just want to get going with what I'm doing, but that warm-up period really helps loosen things up and get them ready for the workout. And then your workout can be adjusted depending on what stage of the program you're in. And then an adequate cool-down period is equally as important. So a solid 5-10 minutes at the walk just to cool down after a workout. And then actually in studies, the recommendation is daily sessions for 5 days a week with 2 rest days. So that's actually very similar to what they recommend for a lot of humans. Despite what we may see on movies, where horses are ridden through all types of weather and terrains and they can do anything, in reality, horses are equine athletes that must be properly conditioned to perform as desired. So if we want our equine athletes to perform at an elite level, the design of the conditioning program should be similar to those designed for elite human athletes. So elite human athletes start with backgrounding if they're trying to get in shape for some sort of competition. So that's low-intensity exercises, which in the horse would be just walk, trot, light stuff, that allow that aerobic conditioning over time and guard against fatigue of the tendons and ligaments and bones and joints. And then over time, over that period of 90 days, adding more skill-specific activities that are a little bit more challenging will help to guard against that fatigue. And of course, it's different for horses in different disciplines. So if you're, struggling to figure out what the appropriate conditioning program is, finding a mentor or a coach in that discipline can be invaluable in helping you figure out what the best way to do that is. And I thought this was interesting in that for aerobic conditioning of the cardiovascular system, a heart rate of 150 beats per minute during exercise is desired. So in an unfit horse that's been off for any length of time, like over the winter, this rate can be reached by loping for as little as a few minutes. It does not take very long for an unfit horse to get to this level. And if they're kept at that level for too long, it definitely can result in fatigue and set them up for injuries. So that's not uncommon in 10 minutes or less at those levels that they'll start to get up to those higher heart rates and need a break to recover. And it's also important to note that aerobic fitness, so how fit they feel, come back a lot quicker than conditioning of the musculoskeletal system. So actually getting their muscles and joints and tendons in shape takes a lot longer than what it can seem, because they'll be like, they've got their breath, they're not sweating as much anymore, it feels like they're in shape, but you got to stick to it for that length of time. Because conditioning of that musculoskeletal system is what's going to prevent injuries and lameness. So when thinking of conditioning the musculoskeletal system as opposed to the cardiovascular system, they've done a lot of work to show that the bone tissue, the tendons, and the ligaments respond really well to that interval training. So interval training is multiple short duration sessions of moderate to intense exercise that are then integrated with just going back to some walk or some low jog. And that's preferred over really long periods of trotting or loping. And I think that is something that we're learning over time is a much better practice. But traditionally, I think, certainly growing up, I'd trot them for ages and I'd lope them for a while and then we'd quit. And I've only now gotten into the interval training and I see a huge difference in my horses. I actually have an app on my phone, the interval training app that I've got when I'm getting them back into shape. It'll beep at you at every interval. And my mare's figured out that as soon as it tweets at her, she's like, whoop, and then it tweets again, she walks, and then it tweets and off she goes. So I gotta be not paying attention, or she'll take off without me, so if long periods of exercise are introduced too rapidly, especially in younger horses, they've shown that microfractures, so tiny little things you can't even see, can occur at the end of the long bones, close to the joints. And we think that's part of what sets those horses up for arthritis. And it's also really common in horses undergoing training to develop tendinitis. Up to 40% of performance horses show measurable evidence of it without actually being lame. So if that keeps going without an adequate rest period, that's where we're going to start to see trouble. And definitely a lack of conditioning, and why I put it in here is because that's often what leads to lameness and is a major contributor to that. So we'll go on and talk about that in the next slide. Lameness is any alteration in the horse's gait, and it's typically due to pain. It's a word that most horse people, and especially competitors, loathe. It's often a term synonymous with negativity. Everybody hates to hear that their horse might be lame. And it's certainly good grounds for concern, but I want to stress that if you do think your horse might be lame and experiencing some discomfort, you'll be way better off in the long run if you deal with it sooner than later. So horses with lameness present anywhere from just a reduction in performance, or just not performing up to their capability, to a change in attitude or crankiness, to bucking, to difficulty with certain maneuvers that you do in your discipline, to an actual noticeable limp or head nod or hip hike or shortness of stride that we think of as a typical lameness. So in this next slide there's a video, which I think we might have to it wasn't working in the PowerPoint earlier, so he's just going to pull it up a different route here. Because this is actually my horse a couple of years ago now, that she was definitely trying to tell me something. You'll see in the video. Once we get it going here. So this is actually, I was just trying to get her back into shape to start competing again. And you can see she's swishing her tail. You'll see her kind of shake her head around. She's just kind of annoyed. And then once you get coming around the third barrel here, just not happy. She's usually pretty chill. Then she comes around the third and she's like, you know what, screw you. I don't want to do this anymore. Something's bugging me. So with her, I kind of went all different routes, tried to investigate everything that could be contributing, and eventually did narrow it down to a really, really early suspensory injury. So she injured her suspensory ligament somewhere along in the training program, and fortunately found that early enough that she could have enough of a layup period, we could treat it, and she's back on track now. So I think if those things are ignored, that's when you get the major issues with the tendons or the ligaments or the joints, where it becomes harder to come back from that. This one here. When lameness occurs, it really is best if the horse is seen as soon as possible. A prompt examination can save you time, money, frustration, by diagnosing and treating that problem immediately. This can also prevent further damage going forward. So the goal of early examinations is to keep those small problems from becoming major and even career-ending ones. So the key in any lameness exam is obviously determining what's causing the lameness. And having an accurate diagnosis is what allows for the most appropriate treatment that's going to get them back to doing their job as soon as possible. As competitors, we often think that lameness is just coming from the legs, but there's all sorts of things that can cause a horse not to be moving properly, and that can be in the neck, the withers, the back, the loin, the hips, and finally their legs or their feet. And I'm a definite believer. I think we've gotten in a bad habit that a lameness exam typically means joint injections, and I don't think those two should be synonymous. I think there's a lot of things that need to be caught and dealt with before we get to that point. But we will talk about those for sure a little bit more in depth. But I did want to take a moment to talk about the Lameness Locator, or the Equinosis Q. They've just recently changed the name of it. So this was developed by Dr. Keegan at the University of Missouri after numerous years of testing and validating on getting this as accurate as possible. Where this technology is indicated is in any subtle lamenesses that just aren't really that apparent. This really was the only way that I could identify that lameness in my mare as to where it was coming from, because she really truly didn't look lame to the eye. It's also really helpful when there's more than one leg involved, or if one leg is causing another leg to look lame. That's not uncommon at all. It also really helps to interpret nerve or joint blocks when you're trying to pinpoint where that lameness is coming from, because it gives you a really reliable answer as to whether or not that diagnostic technique was effective. And then when we're monitoring improvements or rechecking a horse after treatments, it's really helpful to know how much they're improving with your treatments and whether you need to be altering things. And we've even used it, and I now use it on my horses all the time, as a screening tool before and at the end of a show season, so that I know if there's anything coming on. And it doesn't necessarily mean that it's going to be a problem, but it's often something that needs to be watched to know whether or not it's going to be a concern. So the system is made up of a series of 3 sensors, and that's what's in this picture here. And I'll show it to you on a horse in the next slide. But these sensors help enhance our clinical lameness exam. So while we're watching the horse go, they really help us quantifying the lameness. They put a value on it. So it provides further support for which limb or limbs might be affected, the severity of the lameness, and the timing when peak pain is occurring. So is it happening when the leg is hitting the ground, when it's in the middle of their stance, or when they're pushing off? Because those things all tell us different things about what we might think would be involved. So one of the sensors goes on the horse's head. We can flip ahead here one. So it sits on the head in a little bonnet there that makes him look really cool. There's one on the pelvis, and then there's one that goes on the front of the right front leg. While the horse is trotting and we're watching go, those sensors are sending data back to a tablet wirelessly for almost instantaneous analysis. And then we use that in conjunction with our visual exam to help sort out what might be the problem. The sensor that's on the head and the pelvis are accelerometers, so they measure how much the head and the pelvis are moving up and down, and compare that on one side of the stride to the other. The one that's on the right front foot is called a gyrometer, so it essentially tells the machine when the right front's on the ground, and when the machine knows when the right front's on the ground, it can figure out when all the other legs are on the ground and help us with timing. And it's that asymmetry of head movement or pelvic movement that helps us sort out which leg is involved. So after we collect our data, this is what we wind up here, is a plot with all the different strides on it. All the colored lines are strides. And in this horse here, it's got head movement asymmetry in the right front impact phase. So every time the right front hits the ground, its head is moving asymmetrically. And it's also got it in the right hind impact phase. So when we see, various patterns like that, we can use that to help us sort out whether maybe it's all coming from the right hind and it's just showing like a right front, or maybe it's coming from the right front and it's showing some compensation in the hind end. There's some definite patterns on that help us figure out which leg is actually the problem. There was a really interesting study in 2012 actually as well, where they induced lameness with a screw in the shoe. And they showed in that study that the sensors were able to detect lameness 1/2 turn sooner. And so as they're screwing that screw in, the sensors could see it sooner than the people who were watching the horses. And that's simply because it has a higher sampling frequency. It samples at about 200 hertz, as opposed to the human eye, which samples at about 15 to 20. So it samples 10 to 20 times faster. So it's really helpful for the exam, but it definitely can't replace what we're seeing and interpreting in that exam. To further pinpoint it, then we got to put our hands on the horse. So you have to, palpate the horse, see if we can find heat, swelling, increased fluid in the joints, anything unusual with range of motion. We'll often put some hoof testers on their feet, see if there's something bugging them down in their toes. And then we'll use some flexion tests. And flexion tests are just designed to exacerbate a lameness. It helps us pinpoint where it is because we can make it more lame with those flexion tests. And then we usually go on to try and pinpoint it to an exact area of the limb with what are known as diagnostic nerve and joint blocks. So those we just use some local freezing in certain parts of the leg until we eliminate the lameness, and then we know that's where it's coming from. And once we've pinpointed it, then we can go to different imaging techniques, whether that be x-rays, if it's the bones or the joints, ultrasound, if it's the soft tissues, or in some instances when we can't see either of them, or we need more detail, there's now some pretty readily available MRIs and CTs around that can help us sort those ones out. So all of those things can help us arrive at a diagnosis. And then when we have our diagnosis, go ahead, then we have to decide what the heck we're going to do. And much to our dismay as competitors, and I definitely know this feeling, sometimes that means rest. You're like, no, it's the beginning of the season. But you know, I found it really interesting as I was watching the Olympics last winter as well, that when they were interviewing one of the Olympians about an injury she'd sustained earlier in that year, her interpretation of that was she's like, she couldn't wait to hear how much time off she had. Was it 3 months? Was it 6 months? Was it 9 months? And I was like, that is so crazy. Like that's, you know, that's the first thing they think of in athletes, in human athletes. And in horses, like, when do we go back to work? When do we go back to showing? And it's just totally opposite. So I think that's something that, you know, as we learn a little bit more about these injuries in horses and are able to pinpoint them better, we'll get better at figuring out their appropriate rehab schedule. But in certain situations, there's definitely some targeted treatments where we can get them back to work and back in competition a lot sooner. And so joint injections is probably top of the list. We do use those a fair amount. Other biologics like IRAP, PRP, or stem cells, OSPOS in children, anti-inflammatory shockwave, there's all kinds of stuff. And unfortunately, I don't have time to go into all of those in this presentation and when they might be indicated. But just kind of wanted to, you know, throw them out there, and fortunately it seems like there's all sorts of new advances all the time on things that we can do to treat these guys. But I did want to talk a little bit more in depth about joint injections because we do them so commonly. So we're going to talk about that a little bit more in the next few slides. So joint injections are basically indicated whenever a component in the joint is inflamed or angry. So that could be the membrane in the joint that produces the fluid, that could be the capsule of the joint, or that could be the actual cartilage or the bone that makes up the joint, as is the case with arthritis. Ideally, we perform it when the pain has actually been localized to a certain joint with diagnostic anesthesia. But, you know, by far the most common thing that we're treating with it is osteoarthritis. And osteoarthritis is a disease of joints that a lot of different things can cause. And it just results in the progressive degradation of the articular cartilage. If we look at the diagram on the right-hand side there, the line splitting down the middle shows the normal side on the left and the disease side on the right. So we often see a problem with the cartilage, which lines the ends of the long bones, and that's meant to allow those long bones to slide smoothly across each other. But when the joint's inflamed, that starts to get degraded, and you start to get bone-on-bone contact eventually, which is quite painful. They'll also get inflammation of the lining of the joint that produces the fluid, so they'll often put more watery fluid in there than they're supposed to. And then the capsule itself can become fibrosed, so the joint just doesn't have the same range of motion and flexibility. And this can affect a horse of any age. It's not just old horses. Something happened in that horse's life to start that inflammatory cycle, and that's all it takes. It accounts for probably about 60% of lameness problems in our performance horses, so it's pretty darn common. As Dr. Wayne McElraith would say, he's a specialist in the field of equine joint disease and medications, it can be caused by either abnormal forces on normal cartilage or normal forces on abnormal cartilage. So there could be a problem with the cartilage already, or there could be healthy cartilage that we're doing something wrong and creating some issues. So in younger horses that have normal, healthy cartilage, arthritis is predominantly trauma-related. And trauma can even be from overuse, repeated cycles of athletic trauma, and they're not getting that adequate rest period for their bone and their joints and their synovial lining to recover from. It can be fractures that involve the joint, and even those little microfractures that come up with overtraining. It could be an injury to a ligament that is supposed to support that joint, and if the ligament is injured or inflamed, that joint loses stability, and that creates some inflammation in there as well. So any of the factors that negatively impact the cartilage can overcome its ability to repair itself, because normally if they've got that rest period, they've got a normal cycle of wear and repair, and it kind of goes back and forth. But if we overwhelm that ability, then that's when we start to go down that road. And in contrast to that, when in the horses where you've got normal forces that cause degeneration of cartilage, that's usually because the cartilage has already been damaged, or the horse is just aging. Older horses' cartilage is not nearly as spongy and resistant to trauma than young horses. And then there's actual problems with the horse's joint itself, like OCD lesions. So that's where the bone doesn't form properly from cartilage from the get-go, from when they're a baby. So that's going to set them up for osteoarthritis in those joints as well. But regardless of the cause, the result is a hot, swollen, and painful joint and a lame horse. Early diagnosis of this can be quite challenging. That's because when we want to catch it is the time when there's not always stuff on the x-rays yet. However, if the veterinarian gets to see it right away, they can often pick up on those little indicators. So there's extra fluid in that joint, there's heat in that joint, there's stiffness there. Allow it to catch it in that early phase where we can hopefully slow down that process. That's opposed to weeks after the problem when we've already got the swelling, heat, pain have resolved, and we've already gone down the road of starting to create some destruction in that joint. When the inflammation is present in the joint, it produces more harmful enzymes that then create an ongoing cycle of trouble that perpetuates that problem. And if it's left untreated, that deterioration just progresses faster and faster, and you can get a fairly severe arthritic joint that can be difficult to treat in no time. So it is a progressive disease, unfortunately, with no known cure per se as of yet, but that doesn't mean it's unmanageable. Once they do develop it, it slowly progresses for the rest of their life, and at some point in their life, it usually means they're going to need some treatment, just to help manage that pain and discomfort, help with the swelling, prolong their athletic usability, and in some cases maximize their lifespan, because it can be debilitating enough that you wonder how their quality of life is doing. So as I mentioned earlier, inflammation of the joint is what causes those destructive enzymes to be in there and start that cycle. So sometimes in those early stages of joint injuries, we might decide to medicate the joint with joint injections to try and alleviate that inflammation and hopefully slow down or prevent the development of OA. And then, of course, we use joint injections to actually treat arthritis as well. That's our best way to get them more comfortable if they've already got arthritis in the joint. So we inject often a combination of things, and most common it would be a combination of the corticosteroids and the hyaluronic acid. So the steroids are potent anti-inflammatories that help to take that inflammation out of the joint and relieve the discomfort and restore the fluid in there. They had gotten a bad rap in the past, but there's been some pretty good research lately to show that they really do have very few detrimental effects when they're used appropriately. So they decrease that inflammation, allow the joint to start producing good lubricating fluid again, like they should. And then the other component that we typically put in there is HA. So HA is normally produced by the membrane of the joint, but in joints that are inflamed, that is impeded. So they're not making that nice lubricating component. So we do give that in two different forms. We'll sometimes give it IV, so we give it to the horse as a whole, and that we think sort of kickstarts their ability to make their own healthy HA. And then in other instances, we actually put it right into the joint to kind of do a lube change. You put it right back in there, give them nice healthy fluid again, and make them more comfortable that way. And then there's been a lot of work done over the last few years trying to figure out whether we could have more beneficial effects with things that are biologic, so they come from the horse, and we process them in different ways and put them back into the joints. So those would be the PRP products, the IRAP products, and the stem cells. And there's definitely some promising stuff out there as to whether or not that stuff works. But I think there's going to be a lot more literature come out on that too, as to what might be the most beneficial product. And then probably the newest kid to the party is the Noltrax Vet. So this is a gel product that can be injected into the joint that essentially creates a little spongy matrix in there. Since it's so new, we've only had a chance to use it a handful of times, and it seems to have some promising results, but we kind of look forward to getting that one out there a little bit more. It promises to decrease the number of injections a horse will need, so we'll see about that over time. So in terms of joint health maintenance and how we try to prevent some of these things, by far, I'm going to go back to conditioning. If we have our horses appropriately conditioned, they're going to be far less prone to developing arthritis. In the performance horse world, anybody you talk to is going to give you their newest, best thing for treating joint disease. But unfortunately, a lot of the other products that aren't on this slide are not approved for use in Canada yet, and some of them are made by compounding pharmacies, which are pharmacies that don't require a license to make their products. Like they can just put these drugs out there. So they carry a higher risk for sure when we're using those products in horses. And personally, myself, they make me a little bit nervous. If I'm treating one of my good horses, I want a reputable product that's pretty darn safe, because I don't want to run into any issues that are a direct result of the product that I gave them. So I've had pretty good luck with these, and I think we've got a lot of horses that do really well on these products. The major downside to the ones that we've got on the slide there is that Adequine right now is still very difficult to get in Canada. I keep saying that every time I talk to the reps at the conferences that they tell us it's coming back, but it's still like a serious black market product. You have to pull teeth to get some out of the States. But so those two products, Legend and Adequine, work very well together. Legend is a product that can help them make more better lubricating joint fluid, and Adequine provides them with the building blocks for repairing their cartilage. So we can help the fluid, we can help the cartilage, and those two work pretty darn good together. And then there's also a lot of products on the market that in the supplement industry that people use to help prevent arthritis. And so I just wanted to point out a couple of things where there's actually some decent science behind them. And so the two that are actually showing the most promise in the literature that they've done lately are products that contain green-lipped muscle and products that contain undenatured collagen. So those two have been shown to have a pretty decent effect. Versus our traditional ones of glucosamine, there's some studies out there lately that show that only 2 to 5% of what we're feeding them is actually being absorbed. So that's some pretty expensive poop when it's all just getting pooped out the back end. And similarly with chondroitin sulfate, their absorption of that is really variable, and there's some question as to whether any is absorbed at all. In humans, they've shown that there's no change in blood levels after ingesting chondroitin, so if blood levels don't increase, there's no way that that product can have an effect on the joints. So just some food for thought there. So we'll kind of move on to my favorite thing. If you were here a few years ago at the Podiatry talk, I'll try to rein myself in because this is a special area of interest for me. So I've just covered, just a couple slides because I think that maintaining a performance horse's feet is just as important as anything. And one of the most valuable tools that we have for evaluating failure and making sure that the horse's mechanics and their feet are doing what they need to be doing are using some shoeing survey radiographs. So these can be used to detect problems early and allow us to make adjustments to the horse's feet to prevent problems going forward. So they're very similar to taking your car to the mechanic for wheel alignment or checking the tire pressure to prevent a flat tire. You just kind of get a baseline, you see where things are at and whether or not you need to make any tweaks to let that foot work better. And oftentimes our thoughts and ideas about how the bone is actually oriented in the foot when we look at the outside of the foot is a lot different than what it looks like on the x-ray. And so having that frame of reference for where the bone is in there and what the angle of the bone is can be really helpful. So they're definitely a really good investment, especially for top prospects or performance horses, to try and get that baseline and try and get that foot functioning properly. And definitely, in my mind, should be considered when purchasing a new horse. I mean, a significant portion of lameness comes from the horse's foot. So if you've got that baseline and know what you're getting yourself into when it comes to their feet, that can be really important information to have. So some of the stuff we look at, I'll just go over this stuff real quick, but these x-rays are taken at a slightly lower angle than our normal foot films, and they allow us to look at where exactly the center of articulation is, which is going to come up here in a minute, I think. So that's where that joint should be rotating about. That is where we want to have our foot balanced around. It can also help us look at the angle of the bone in there and make that as optimal as possible, so that's called the palmar angle. We can then look at the horn lamellar zones, which is the angle of, or the distance between the bone and the outside hoof wall, which can indicate different disease processes going on there. And then our breakover point, which we can optimize if we need to, our sole depth, so that we can get growing them some more sole if we need to protect our coffin bone. I'll just wait for that one to come up. It should, there it is. And then our tendon surface angle, which is the angle that the deep digital flexor tendon has to run across to get down into the foot, and then the alignment of the three bones in the foot. So we can gain all that information off those radiographs and put that to good use in designing an exact program for that horse's foot to make it work most effectively. All right, so then we're going to change gears a little bit and talk about another important component of performance horses' health. So that's their airway. And probably one of the biggest things we see affect performance in a subtle way is what's known as inflammatory airway disease. So this is caused by an immune response to dust, molds, allergens, or endotoxins in the air, and definitely can negatively affect performance because it can affect that oxygen exchange in their lungs and their ability to get oxygen to their tissues. So what we typically see with this is that the horse is normal at rest, but once they get exercising, they often start to cough. And they may be exercising tolerant or not be able to do the exercises that they normally would. Diagnosis of this, we typically will do what's called a bronchoalveolar lavage. So we stick a catheter up their nose, down into their windpipe, and right down into their lungs. And we'll put a little bit of fluid in there, and we'll suck it back out, and we'll look at those cells under the microscope. That can help us determine if there's any inflammation in there that we need to be treating to improve their airflow. Treatments are a combination of steroids and bronchodilators to help those airways out. And then probably the biggest thing for managing inflammatory air disease is decreasing their exposure to dust. So all of those things can be taken into consideration and should be taken into consideration if your performance horse starts coughing. There's typically a reason there, and it's a good thing to look into before that becomes a problem. And then the next thing that's probably more common in speed horses, so that's race horses, barrel horses, eventers, but that's what's known as exercise-induced pulmonary hemorrhage, or a horse that's a bleeder. It's not totally fully understood yet, but we think what causes it is that when they're increasing at their maximum intensity, their blood pressure gets to such a high level that the tiny little capillary blood vessels in their lungs burst, and they actually bleed right into their lungs. So this can be a hard one to detect also, because sometimes there's no clinical signs. Sometimes they can just, not be performing to their best. They're just not, running like they should. They could also be coughing after exercise. So they come out, finish an eventing course, so they come out of the arena and they start to cough. And it's actually only about 5% of horses that actually have blood come out their nostrils. So there's a lot more that go undiagnosed than we appreciate. Dr. Renaud Leguillet at the University of Calgary Vet School went around to a number of different barrel racing jackpots in Alberta over the last year doing a study and offering free endoscopy after the horses run. And I think they found that somewhere up to 50% or 45 to 50% of horses are bleeding, and only I think 5% of those in that study actually had blood coming out their nose. So it can be a definite problem and something to watch for if things just aren't going right. Like, gosh, this horse should be clocking better. I should be making better time. There could be a reason for that. Similar diagnostic technique for this, we use the camera, run it down into the lungs, check if there's blood in there, and then we can take a sample of the cells in their lungs similar to for the inflammatory airway disease if needed. And unfortunately for this one right now there's no cure for it, but there's some different management things and treatments that can be done to help them a little bit while they're performing. Because for some horses this can be quite alarming. They get halfway through a pattern, or they get halfway through an eventing course, and all of a sudden they just can't quite breathe properly. Some of those horses tend to get a little stressed, as you can imagine. So this next slide is a bit of a digression, but I thought it important to add a few comments about it because travel can have such a big effect on the airway health especially. And I just found a really cool paper that talked about travel that were some things that I hadn't been aware of in the past. So definitely poor performance, health disorders, and infectious disease are a really common complication of travel. The biggest disease risks are diarrhea, laminitis, pneumonia, or otherwise known as shipping fever, and dehydration. So there was a really good paper done in 2015 that summarized all the literature that's been done in the last 20 years on transport and travel. And some of their general recommendations I put up here because I thought they were just interesting food for thought. So they did show that for horses that have to travel more than 3 hours to a competition, that that's the same effect on their muscle enzymes and their metabolic processes as cantering for about 1,500 meters. So they need a bit of a recovery period before they compete to allow those muscle enzymes to return to normal and allow them to compete at their best. This in the rodeo world is something that I think, not very many of us stick to. We pull up, saddle up, go. And I think it's something that, as we learn more, I think we're going to, need to be a little bit better about that. And so if you can give them that recovery period of about 2 to 4 hours before competition, they're probably going to feel a lot better going into the pen. And then, other things to keep in mind when trailering is the amount of dust that can be kicked up in the trailer. So that's simply just from the airflow circulating around the trailer. Feeding dry hay in the trailer has been shown to affect that air quality quite significantly. So especially when a horse is at risk for inflammatory air disease, paying particular attention to that can really help manage that. So what they've shown in studies that it's best if the hay is soaked and if it's actually placed on the floor rather than in a manger, which drives me nuts because my trailer has a manger. I'm like, what? But so when that horse can lower their head, it enhances the clearance of the respiratory secretions and the stuff that's in their lung, and definitely reduces their risk for getting that shipping fever or pneumonia after travel. So definitely something to think about too for those longer trips if you're heading out of the country or out of province. And then again, the other interesting thing was actually in the literature. Everyone always asks me, when should you stop? How often should you stop? How long should you stop for? And I always kind of just winged it based on what I thought before, but this paper really pointed out that every 4 hours is really the ideal time. And one of the biggest things for that is water and urination. So especially if outside temperatures are high, they do need water at least every 4 hours to keep them from getting dehydrated. And it's really hard to pick up on any dehydration level less than 5%. But having said that, they've shown that even 2 to 3% dehydration can dramatically affect their performance. So that's in that range where you can't even really tell that they're dehydrated, but they're dehydrated enough that they can't perform to their biggest potential. And then the flip side of that is they need to posture urinate every once in a while. And it hadn't occurred to me too that when the trailer's moving, especially geldings, some of them won't posture urinate because they just don't feel comfortable and stable enough to actually stretch out and pee. So letting them stop and rest for half hour or so, at least every 4 hours, will let them urinate. And it's definitely, we don't get a whole lot of greater than 30-degree days around here, but it's worth noting that heat stress shock in horses is definitely possible when those temperatures are high, and that's especially true if the trailer's not moving. So if you're stopping for lunch and your horse is in the trailer and it's greater than 30 degrees, that could be a significant problem. And then the other interesting one I found was that horses travel best facing backwards, and that is a fact. So they show that there's fewer side and toe impacts, lower heart rate, they move less, and they actually rest better during travel and don't lose their balance as much when they're facing backwards. So that was an interesting, fun fact. All right. Sorry, I had to include that one in there because I thought there was some interesting stuff in the travel slide. So then the other facet that we need to be in tune with in the performance horses is GI health. And the number one thing that we have a problem with in performance horses is gastric ulcers. 60 to 90% of performance horses that are scoped have been shown to have gastric ulcers. And this causes for this vary a little bit, but that can be anything from feed deprivation or intermittent feeding practices, the way we manage them, to stress. They've also shown that the actual mechanical aspect of high-intensity exercise can cause reflux of acid into the stomach. So horses that train at high speeds, horses that do sliding stops, barrel horses that come around a corner real hard, they just have that abdominal thrust that then can push reflux back into their stomach. Stall confinement has been shown as a risk factor, as well as diets that are high in concentrates. Clinical signs for this are often quite variable. So it can be anything from weight loss to, again, poor performance. So as you can see, poor performance, there can be a lot of things factoring into that. But these are all some things that we can try and sort out to get them back to their highest level. They can have a change in attitude where they're a little bit crankier or they're not themselves, or their appetite can be off. By far the best way to diagnose this is with gastroscopy, so that's where we run a camera down into their stomach and look at the lining. Both of these pictures that were provided by the internist at the university show two different severities of ulcers. So little ones like this can be a substantial problem in performance horses. Even though they don't look like much, there are some horses where that really bugs them. But then you can get to the other extreme over here where this almost entire area of the junction of the stomach there is reddened and inflamed and sore. So you can definitely imagine that horse why they would not be feeling up to snuff. Treatment for this is essentially lowering the acid content in the stomach, and Gastrogard is by far the most effective way to do that. So Gastrogard is a form of omeprazole that's coated with a darn proprietary formula, which is why those guys can charge so much. But it is the best thing for inhibiting the acid secretion and allowing those ulcers to heal. And unfortunately, the compounded formulations that are out there, they don't have that ingredient, that proprietary formula that allows them to work, and so they just don't work, unfortunately. But then there's some other things for horses that we can do to try and prevent them or manage them, and that, by far the biggest one, is feeding frequent small meals. So horses are designed to continuously graze. So the more time they spend eating, the more saliva they're producing, and that acts as a buffer to the buffer to the stomach acids. Some horses that are high risk for this, we can also put them on a partial dose of GastroGuard so that they're less prone to developing them. We can avoid things in their diet that make them more prone to it. And we can feed some supplements that do tend to help a little bit. So antacids like UGuard, CBUC has been shown to help, and corn oil can also be protective. And then it's also important to keep in mind that NSAIDs like bute and banamine definitely have the ability to make these worse or induce them. So that's in some performance horses that need to be on those medications, it's something worth considering. And then just a quick little note on dentistry. I think we're all pretty well versed in the fact that horses do better when their teeth are floated. And certainly for optimizing performance, this is really important. If we were to stick a bit in this horse's mouth where it's got that ulcer there, the bit is really close to there. And what the bits tend to do is just kind of suck their cheek pouches in just a little bit. And so that ulcer will then wind up rubbing against the sharp points on the outside of the teeth. And if that's happening every time you pick up on that rein, the horse is eventually going to get a little ticked off and not want to be as soft or supple for you. It also helps them keep weight on and just generally perform well and pain-free. And then very quickly, I'll talk about nutrition. It can be a subject of a talk all on its own, so I really can't do it justice here. But I mean, it doesn't take a rocket scientist to figure out that just a well-balanced nutritional program that supplies the appropriate number of calories to meet their demands is really important. So that's typically a nice high-quality forage. So some hay that's got some adequate calories in it, a reliable vitamin mineral supplement, one that's actually got what it says it does in it, and then typically an amino acid supplement can be really helpful as well. So in terms of sorting out which of those supplements are reliable, one of the things that you can use is these NN numbers. So I wanted to point those out because they're easy to miss on the packages, but there's more and more companies that are subscribing to this program. So it's a voluntary program that the companies can be involved in where they have to prove that their products are safe, that they're effective, and that they actually contain what they say it does. Because there are numerous products on the shelf where nobody is asking, like they do not have to prove that what's in their label. Half of it could be sugar and you'd never know. So these NN numbers is a really good way to sort through those. If the product has that on it, they've at least done some homework to say that, yes, what we're saying is in here is actually in here. And then the other, just, food for thought thing I thought I'd add when it comes to nutrition and performance horses is the consideration of rate-limiting amino acids. So for horses to build muscle, they need to have an adequate number of those rate-limiting amino acids. So those, if we're looking at the barrel, lysine and methionine, the one in red and the one in yellow there, those amino acids, if they're not at an adequate level, then they can't build any more protein. The water just runs out of the bucket because they don't have enough of that one to keep building it up. So making sure that there's appropriate amino acids in their diet will help them build that muscle up and perform that much better. All right, I actually think I got through that on time. So there's definitely many aspects of your horse's health that can affect their performance. So knowing your horse and what to watch for to help you detect those problems early and address them will go a long way. You can keep a small problem from becoming a big one. The next slide is just a few little references I used to help me put this together. And then I think I got time for a few questions if anybody's got any. Yeah?
The NM numbers that you're talking about?
Yeah.
Are they actual, I don't know what that means. Is there a certain number? Or
Yeah, can you back that up? Oh, here we go, yeah. So sorry, I meant to be a little more clear about pointing that up. So these are both two products that actually have that number on it. So there'll be, and it is a little tough to see, I bet, but so it says NN dot, and then this one says 4XGR. So that's their registration number with the NN, I forget the name of it. It's a big, long, fancy name for the association that regulates that. But so anywhere on the label. This one's got it down at the bottom, but it'll be NN dot and then a series of 4 letters and numbers on it. So that means that they've done their homework to make it a reliable product. Yeah.
What's the name of that app you have for conditioning?
It's actually just called interval training, and it's got a bluish gray outline with a darker blue center in it. And yeah, if you just type interval training into the app store, it'll come up. Yeah, it's pretty cool actually. Keeps me on my toes, I have to pay attention.